Hello everyone, myself Dr. Malika, DNB Family Medicine Resident. Today we are going to study about the basic management of the snake bite. For an example, when a person stays in a remote area which is far away from the hospital, then how you will guide him? Today we are going to learn about that. Always reassure the patient about that condition and tell the patient to immobilize his limb or her limb with some using the slab. And if the patient takes about more than 1 hour to reach the hospital, we can apply the tourniquet. Yes, you are hearing right. In olden days, all the people used to tie their handkerchiefs, rope whenever they had the snake bite. There is a technique. This technique is known as a lympho-occlusive dressing. But in olden days, they don't know the technique how to use. Because of that, this technique is leading to the limb necrosis, which further leading to the limb amputation. Whenever you use this technique, always make sure that you apply about 5 centimeters above the bite side, and you should make sure that the tourniquet should be released in 20 minutes interval for about 1 to 2 minutes, so that we can avoid the necrosis of the limb. But because of this all high risk of the amputation, the recent trends says to avoid the tourniquet, and we will study the further approach of the patient. As I said, tourniquet should be released at 20 minutes interval for 1 to 2 minutes. If the patient transient period is more than 60 minutes, and try to identify the snake and take the victim to nearby hospital. After reaching the hospital, we have to check the patient vitals and check the bite site, whether there is any edema, any hemorrhage, any history of hemoptysis or the hematolysis. Then give the injection polyvalent antivenom serum. Before giving it, always do the intradermal test with 1 ml. Always keep the injection adrenaline 1:1000 solution in your hand. If the patient is allergic after doing the intradermal test, even in those conditions we have to give the polyvalent antivenom serum. But before that we have to give the hydrocortisone injection so that we can avoid the allergic anaphylaxis. And in those patients we have to dilute the polyvalent antivenom serum and give as a slow infusion. And we also give the benzathine penicillin 1.2 million units to prevent the secondary infection. Diclofenac if the patient had the severe local pain. And tetanus immunoglobulin, tetanus toxoid should also be given. Tetanus toxoid should be given about 0.5 ml IM stat and to be repeated after 1 month. If the patient is in shock or any profuse internal bleeding, blood transfusion may also needed. And a few mnemonics to remember: that viper snake may lead to vasculotoxic, cobra snake may lead to the neurotoxic. In cobra snake may lead to the neurotoxic. In this patient, the patient will be having the Bell's palsy, ptosis and respiratory failure. In those conditions, there may be chances of patient getting the intubation. In viper may also lead to the vasculotoxic. The patient may have the hemorrhagic, acute renal failure, some serum electrolyte imbalance. In sea snake, the patient may have the myotoxic. The patient will be having the myoglobinuria, even the acute renal failure. Hope this will be helpful. Thank you.